Welcome to a truly essential conversation. When you visit your doctor, they are looking at more than just your blood pressure and lab reports. They are reading a narrative, a life story, written in the language of self-care. And for older adults, the subtle signals of poor personal hygiene are not merely cosmetic issues. They are flashing red flags that instantly alert medical professionals to dangerous, underlying health crises. Today, we are exposing the 7 most critical hygiene mistakes seniors make, mistakes that can secretly invite heart disease, stroke, dementia, and even cancer. Correcting these habits is not just about looking better. It's about extending your life and protecting your precious independence. Let's start with a silent killer hiding in plain sight. Oral hygiene. The most common mistake we see is neglecting the mouth. This means using a frayed, worn-out toothbrush, failing to brush for a full 2 minutes twice a day, and skipping the floss. This neglect allows gum disease to flourish. Here is the terrifying truth. The bacteria from chronic gum disease do not stay in your mouth. They enter your bloodstream and travel directly to your heart, causing inflammation, increasing your risk of stroke, and accelerating cognitive decline, including dementia. Your oral health is your cardiac health. The solution is simple. Replace your toothbrush every 3 months. Better yet, invest in an electric one. Commit to 2 minutes of vigorous brushing and never, ever skip flossing. Your heart depends on it. Next, we address the critical issue of infrequent bathing and neglected skin care. As we age, our skin changes, and the frequency of bathing often decreases. But your skin is the largest organ you possess, and its condition is a diagnostic window into your internal health. Infrequent washing can mask critical visual cues that doctors rely on: changes in skin color, texture, or persistent itchiness. These subtle shifts can indicate severe internal problems like uncontrolled diabetes, liver disease, or even early kidney failure. When you skip a shower, you risk missing the vital signs your body is screaming at you. Establish a regular bathing schedule, at least 3 times a week. Use gentle, fragrance-free cleansers, and crucially, apply moisturizer while your skin is still damp. Most importantly, use this time to conduct regular self-checks for unusual changes. Do not let hidden illnesses go unnoticed beneath the surface. Moving on to the oft-ignored area, nail care. Thick, yellow, or discolored nails are not just unsightly. They are an urgent indicator that something is wrong systemically. Your fingernails and toenails can signal over 20 different systemic diseases, ranging from anemia and thyroid problems to critical cardiac issues. Fungal infections, common in neglected nails, are a clear sign of a severely depressed immune system. Keep your nails trimmed straight across to prevent painful and dangerous ingrown nails. Maintain cleanliness and dryness, and ensure your footwear is breathable. If you notice any drastic changes in color, texture, or thickness, view it as a health warning and seek medical advice immediately. And now we arrive at mistake number 4, the one that shocks doctors the most, and the one that often carries the deepest shame: improper incontinence management. Over 50% of older adults silently suffer from incontinence, often hiding it rather than seeking proper treatment. The risks here are immense. Untreated incontinence leads to severe, dangerous skin infections, dramatically increases the risk of debilitating falls as people rush to the restroom, and, tragically, fosters social isolation. But the most alarming factor is this: incontinence can be a major red flag for serious, treatable conditions like bladder or prostate cancer. By concealing the issue, seniors risk masking deadly symptoms. Never ever feel ashamed to discuss bladder issues with your doctor. That conversation is a sign of immense strength and a commitment to health. Use absorbent products specifically designed for incontinence. Change them immediately when soiled, and remember, this condition is often a symptom, not a final diagnosis. Get medical attention. Next, let's discuss ear hygiene mistakes. The single worst offender here is the cotton swab. You must never insert anything smaller than your elbow into your ear canal. Using cotton swabs only pushes earwax deeper, leading to impaction, hearing loss, and potentially dangerous inner ear infections, or even a punctured eardrum. Earwax is designed to clean the ear itself. To manage excess wax, clean only the outer ear with a warm, damp washcloth. If you have significant buildup, use specialized wax softening drops, or schedule an appointment with your physician. Protect your vital sense of hearing. Our sixth mistake focuses on poor foot hygiene. Your feet are your foundation and hold critical clues about your entire circulatory and nervous systems. Ignoring minor cuts, dryness, or color changes in your feet often reveals the early stages of diabetes, neuropathy, or vascular disease. The horrifying reality is that proper, daily foot care can prevent up to 85% of diabetes-related amputations. Every single day, you must wash and thoroughly dry your feet, paying extra attention to the spaces between your toes. Inspect your feet regularly for any bruises, cuts, or changes in temperature or color. Wear clean, dry socks, and moisturize dry areas, but avoid moisturizing between the toes. Do not tolerate pain, numbness, or any wound that refuses to heal. Your mobility and your independence rest on the health of your feet. Finally, we address hygiene issues related to medication. As seniors manage multiple medications, they often experience side effects that impact personal cleanliness, such as excessive sweating, altered body odor, or severe dry mouth. These changes are not minor annoyances. They can signal toxicity or dangerous drug interactions. Dry mouth, for example, drastically increases your risk for oral infections and tooth decay. After starting any new drug regimen, meticulously track all changes in body odor, sweating patterns, or oral moisture. Stay intensely hydrated. Report any unusual changes immediately to your doctor. Never adjust a dosage on your own. Your vigilance is key to managing medication safety. Good hygiene is the foundation of a long, healthy life. These aren't minor oversights. They are potent indicators of systemic health. By fixing these 7 simple mistakes, you are actively choosing health, fighting disease, and securing the vibrant, independent life you deserve. Your health journey begins now, with the care you show yourself every single day. Thanks for watching, and be sure to subscribe for more essential health advice.